Hi, and welcome to the channel. I'm Nate, a doctor specializing in obstetrics and gynecology. Every year there will be medical students rotating into their obs and gynae placement, looking unsure with what they're meant to be doing. I know this because I see them every year, and I used to be one of them. This specialty is different from, say, anesthetics, which will involve being in theatre on most days, or emergency medicine, where all the action happens in the same place. Obs and gynae is confusing, especially with where you're meant to go, what you're meant to do, and how to get stuff signed off. And seeing pregnant women can feel different from your standard medical history taking. And then you have to learn how to do a speculum exam. Yikes. So I figured, why not make a video explaining all the possible sessions you'll be scheduled for, and where to go to get your logbook signed off, and hopefully spend less time waiting about for something to happen. And I'll add in a few bonus tips and advice throughout this video. I'll also be publishing a companion video about medical student placements, and when it's ready you should be able to see it round here, and also in the description below. If you haven't done so, subscribe to the channel and give this video a like. Your support means a lot to me. Of course, different medical schools will have slightly different curricula, and different hospitals may have slightly different expectations on medical students on rotation. This video will cover the general things. Okay, let's start with labour ward. This may sometimes be lumped in as obstetrics on call on your schedule. Essentially, this is where women with high-risk pregnancies will labour. Occasionally, we may also manage women who have given birth or are yet to give birth on labour ward, especially if they're unwell and require more intensive monitoring and care. Some labour wards will have an adjacent midwifery led unit, where women with low-risk pregnancies can give birth. When you're on this shift, your day will start with a handover in the office between different doctors and midwives, and you'll be bamboozled by terms like ARM and SHROM. But don't worry, take note of what you don't know and ask after the handover. Following the handover will be the ward round, which is when we see all the patients and make provisional plans with them. Oftentimes your role on labour ward will be limited, as things can escalate quickly. This is also where you'll most often hear the emergency buzzer. Nevertheless, we're more than happy to answer any questions you have. Doctors on call will be involved with emergency procedures such as caesareans and assisted vaginal births, managing postpartum hemorrhage, shoulder dystocia, and so on. Most medical schools will expect you to witness a vaginal birth. These shifts are the best time to do so, and the best way to get this sign off is to speak to the senior midwife in charge. I repeat, the senior midwife in charge.
Now I'm running this ward, young man.
Oftentimes, there are also midwifery students who are present who will need to be involved in labour care and births. If there are too many students present during the shift, you may not be able to attend a birth. Again, check with the senior midwife to see if there are any shifts during your placement when there are no midwifery students, though sometimes that may mean coming in for a night shift. I've never really understood the point of witnessing a vaginal birth as a medical student. I saw one, and I'm grateful to the couple who gave me this opportunity, but I've never felt that it was necessary for my learning. I think it's best to learn about the stages of labour, the factors at play for labour to progress, and my favourite, the cardinal movements in labour before attending this shift. That way, it will make your time witnessing a vaginal birth more educational. And if you have permission to be in the room, always ask the midwife you're with to see if there's anything you can help the woman with. It could be getting some ice or a cool towel. It's much more rewarding when you're actively participating. During the shift, you may also be involved in antenatal and postnatal ward care, though they may sometimes be scheduled separately. Antenatal means before birth, which means you'll see pregnant women with acute problems requiring inpatient care, like vaginal bleeding or severe pain. There are also people having an induction of labour, which, for one reason or another, are advised to have this done in hospital. This is a great place to take a history from patients, as it can be quite boring being stuck on a hospital ward, and so some people are quite happy to have a chat with students, after which you can present the history to the team. There have also been times when students have gotten a valuable insight to the patient's living situation that the professional team has missed, which can have a huge impact to the patient's care. So your involvement may not only benefit your learning, but also for the patient and the team. And this is also a good place to practice abdominal examination of a pregnant person. Postnatal means after birth, so you will see women who have recently given birth. This is the place to be if you love seeing newborn babies with tiny fingers and toes. Next up, we have the day assessment unit. Think of it like the A&E department, but exclusively for pregnant people. So you'll see people in their second or third trimester with acute problems, like reduced fetal movements, suspected ruptured membranes, abdominal pain, and so on. Again, this is a good place to take clinical histories with some degree of brevity and perform abdominal assessments, and also to see how common acute problems in pregnancy are managed. You may also have elective caesarean sessions scheduled into your attachment. These sessions are useful for when you're learning to insert a female catheter, which is part of the process of performing a caesarean section. It's important to note, always ask the pregnant person for permission before they're admitted into theatre, and it's good to introduce yourself to the patient beforehand in what is a very important moment in their life. And another thing, if you start to feel faint, please let us know. We now move on to antenatal clinics. This is where you'll see parents carrying high-risk pregnancies and how the pregnancy is being cared for. Different consultants may specialize in different things. Some consultants may focus on diabetes in pregnancy, while others on autoimmune diseases like lupus.
I finally have a case of lupus.
This is also a good place to perform abdominal assessments and to learn how to use the Doppler machines. Most parents enjoy listening to the baby's heart sounds. There will also be special sessions which will differ from hospital to hospital, like ultrasound sessions, home visits, perinatal mental health units, and so on. Now we move on to gynecology.
Crap, I was meant to go to Gynae.
You'll have acute Gynae or Gynae on-call shifts. This is when you shadow the on-call gynecology team. Your day will involve a ward round of all the inpatients under the care of the team, as well as any gynecology cases present in the emergency department. This may include severe vomiting and dehydration in early pregnancy, heavy vaginal bleeding, and severe pelvic pain. Some hospitals may also have a gynecology assessment unit, which takes in people with suspected acute gynecological problems, like ovarian cyst accidents. This is a good session if you wish to learn how to take blood or insert a cannula, take condensed gynae histories, and perform abdominal examinations. It's also a great opportunity to learn how referrals are made and how and why care is being escalated, as this is what you'll be doing in the future. If there are any acute problems requiring surgical intervention, like an ectopic pregnancy, they will be dealt with in the emergency theatre. Next is Gynaecology Clinic, where people with long-standing gynecological problems are seen. It's important to note that some consultants may specialize in certain aspects of gynecology, like cancers, recurrent miscarriages, fertility, endometriosis, and so on. Ask the junior doctors in the unit, especially the registrars, as they will usually know where to direct you. These sessions are helpful with learning to take a comprehensive gynecology history. As many of these issues have been present for a long while, you can draw out its evolution, and more importantly, you can see how these problems impact the person's life. When you're presenting to the team, start to think, what are the potential management options? And take note at how doctors communicate with patients and how they practice evidence-based medicine when discussing treatment and management. Then you have elective theatre sessions. Note that the starting times for clinics, theatres, on-call shifts can vary, so check with your junior doctors or your tutor beforehand. I would suggest brushing up on anatomy before showing up, or ask junior doctors what sort of questions consultants routinely ask medical students. For me, it's where are the round ligaments, and what's that white stuff over there?
What's this bit?
I wanna say the bowel?
Do you want to say the uterus instead? You know, when a mummy and daddy love each other very much?
Oh yeah, I think I've seen some videos about that.
These sessions are very useful in learning how to do a speculum and bimanual assessment. Again, it's very important that you introduce yourself to the patient and gain permission before they enter theatre. The early pregnancy unit is where women in their first trimester are seen for potential problems, such as a suspected miscarriage, ectopic pregnancy, or molar pregnancy. This is where you'll learn how these problems are investigated and managed. There may be special sessions, like colposcopy, where women with abnormal cervical screening results are seen, or the abnormal uterine bleed clinic, where hysteroscopic procedures are performed, or the 2-week rule clinic, where women with suspected cancers are reviewed. As you can see, there's a great deal of variety within the specialty, which was a big factor that drew me into it. Give this video a like if you found this helpful, and I hope you have a great rotation. Share, subscribe, and I'll see you again soon.